So hi, Steve Oliveris here, CEO of Pinnacle Allergy, and welcome to our podcast, which is called Beyond the Shot. I'm here with Dr. David Dilla with Sleep and Sinus Centers of Georgia. So Dr. Dilla, thank you so much. Appreciate the opportunity to be in front of you again.
I appreciate the opportunity to talk to you.
Yeah, so we're just going to spend some time in here so we can showcase the great work that you do with your patients, and you can highlight your staff here in Lawrenceville, Georgia, as well as the one in Watkinsville. So just got some questions for you, and we'll just have a nice conversation. So if you could just share with me a little bit, but what really inspired you to go into the field of ear, nose, and throat versus other medical specialty?
You know, I went into medicine thinking I was going to be a pediatrician, which I wound up getting exposed to ENT about the third year of medical school. And it's a unique specialty. It lets you problem solve from a position of being able to both treat things medically. For instance, we can do nasal sprays for allergies, we can do pills, we can do antibiotics for sinusitis, we can do allergy shots, we can do allergy drops, sublingual drops instead of actually having to take the shot. And we can have minimally invasive treatments that you can do in the office, or you can have surgeries to solve the problems. And so it's kind of one of the few specialties in medicine where you get to diagnose something that most people don't understand, even in medicine. I mean, the nose is a really weird place, for example. Most people, even in medicine, don't understand the anatomy. It's got a lot of nuances that people don't get. So it's a neat problem-solving opportunity, and it's a unique set of skills. You just don't have the same same exposure in other specialties to be able to see the insides of things like we can. And then in addition to that, you can do everything from allergy to medicine to surgery. It's a great specialty.
Awesome. And how long have you been practicing here in Lawrenceville?
We've been doing this about 25 years. This practice has been here for 25 years. I started this directly out of Emory. Went to Emory from the Navy and went directly from Emory to starting this practice. And started up in Hartwell and Royston and Athens and Lawrenceville, and kind of expanded a little bit from there.
Great. And what you feel has led to your success in this field?
You know, I like a good puzzle. I like solving problems and try and think outside the box a little. You know, everybody likes patients. Everybody likes people. You don't do this job. There are very few people in this occupation, as a general rule, that go into it and spend 8 years in college and another 5 to 7 years in residency that don't enjoy treating patients, because, I mean, there are plenty of other things you can do to make a living. But it's fun to talk to patients, and it's fun to problem solve, and it's fun to have a unique set of skills that you don't get anywhere else.
Gotcha. And what do you feel is the difference here compared to so many other practices? What's the difference of sleep and sinus centers?
We spend a lot of time focusing on the airway and airflow, which is a lot of things that you don't get in terms of nuance about how things like the nasal valve, for instance. We were the first people in the area to treat it. We're the first people in the country to do some therapies that, like the Rhine Air. We were literally the first group in the country to do the Rhine Air. We've got experience with sleep in a way where we have patents on some of the therapies that are out for sleep apnea and for minimally invasive nasal surgery. So we spend a lot of time trying to find better ways to do things that are easier on the patients.
Gotcha. Do you have any unique patient stories that you're willing to share?
I think probably the the most gratifying thing that you do is finding things where you don't really have the answer in your own specialty. We find a lot of people come in with headaches that they think are sinus problems. And so having some extra technology in the office allows you to bypass some of the rules for people. So sometimes we are able to get things done that you can't get done in, say, other circumstances where we can just bend the rules a little bit to help people get something that they need. And I had a patient that had a tumor that we discovered, and the we're able to get him a scan just by picking up the phone and getting some stuff done. And the insurance company called back and told us that, this scan is not approved. They can't justify that because under the circumstances of the story, it wasn't necessary to identify this because there's not, it's a low probability of having a tumor, and the patient had what's called an acoustic neuroma, which is basically a form of brain tumor, if you will, but actually it's intracranial tumor. It's not in the actual brain, but inside, pushing on the brain. And as I'm talking to this reviewer, I said, well, as a matter of fact, if you look at the report, this patient's got a 7-centimeter tumor inside the head that had to be taken care of emergently and had a good outcome. And the reviewer goes, oh.
Should have read the report.
Maybe I should have read the report. Well, maybe, I guess we will approve this.
Yeah. I got you. Well, so you took your time. You found something a little bit outside your scope of work.
Right.
But you had the ability and the know-how and the equipment here to get the patient's care accelerated. It sounds like obviously they had a good outcome.
Right.
So is that personal touch? Is that taking the extra time? Is you own this practice? You're not pressured by certain constraints that would have maybe made that a little bit more challenging for another physician.
Yeah, then that's one of the nice things about practicing in this kind of an environment.
Yeah. Excellent. So I understand you're a pilot. What got you into flying?
I worked my way through college washing airplanes. Okay. And I needed a job. I went out and we were doing this, and I was watching this, and I was thinking, there's a lot of freedom that goes with being able to just walk out, get in the plane, and just take off. One of these days I'm going to do this, and I was getting older and was making one of my milestone birthdays, and I was like, if I don't do this now, I'm never going to get around to it. And I've just been flying the last 18 years, something
Awesome.
like that.
What's your favorite part of flying?
There's a thrill with learning a skill that has the capacity to kill you, and executing that skill regularly, and being able to get yourself into places that you couldn't actually go otherwise. For instance, if you want to go to Macon, finding a flight from Atlanta to Macon is a challenge. Finding a flight from Lawrenceville to Macon is impossible. Mm-hmm. And you can be there in an hour from Lawrenceville. And so those kind of being able to go into offbeat places that you can't see otherwise.
Right.
Kind of like seeing the country in the back of a station wagon was in the 60s.
I got you. So I know recently you had a program and you actually got there faster on your plane because 316 was so jammed up, wasn't it?
Yeah.
So it's nice to have that ability just to go and be where you want to be.
Yeah.
That's awesome. So you mentioned about there's patients and even other physicians have misunderstanding about the nose. What do you feel is the biggest misunderstanding about ear, nose, and throat just in general?
I think people have an idea that you can diagnose sinusitis just based on symptoms without doing diagnostics. Sinuses are basically pockets like steam rooms down the side of a hallway. Mm-hmm. The lungs need to have moist, hot air because hot air that's wet weighs less than cold, dry air. So it's easier to move and takes less energy to move that in and out of the lungs and get the oxygen out of it that you need and to get rid of the carbon dioxide that you have to have. So that process all happens at about 100 miles an hour going through the nose. Mm. So there are all manner of folds and baffles, if you will, in the sense of air baffles like you have in an air conditioner register. Those baffles allow the mixing of the air, and the sensation of that and how it's controlled is pretty complicated, but the sinuses are basically on either side. They have small open ports that drain, and there's all kind of immune functions that go on. And sinusitis is so much more than just an infection. There's almost always an element of immune dysfunction that goes on with chronic sinusitis, either certain deficiencies in vitamins, certain inheritable problems, certain allergy dysfunctions, certain immune dysfunctions, and occasionally some things that are developed with time that have to be looked at, and you have to sort of get a big picture view of it. It's not really as much of a cookie cutter treatment plan as some people think.
Gotcha. What's you feel the biggest mistake that patients make when it comes to their sinuses?
Patients will oftentimes begin to take a new norm when they're having problems. If you have a problem and you wait long enough, you don't really recognize that you're not breathing well. My favorite story was a New York City firefighter who had retired and moved. And he had to be 5'2" if he was, any taller than that, I would be stunned. Mm. And when he was young, he had always wanted to be a firefighter. And he came in for something else, and I was looking at him, and his nose was absolutely and completely closed. It was collapsed. There was no passage for him to breathe. And I asked him, "How do you breathe through your nose?" And his answer was, "I breathe fine." So
normal.
This was his normal. And he had wanted to be a firefighter so badly that he kept failing the height requirement. And so every time he'd go in, the fire captain would exclude him. And so he read someplace that if he laid down, he was about a quarter or a half inch, I can't remember exactly, but half inch short. He heard that if you laid down long enough, you would actually grow in height.
Okay.
So that standing up reduces your height. So he went home and he laid in bed for a week, had his friends take him down on a stretcher, took him in, stood him up, and he barely made the height requirement. And the captain was not happy with him. And so when he first started his training, he sent him out and he said, now get on the end of that hose and open it up. And he turned on the water, and this fellow went up in the air riding this thing, and it bopped him in the nose and flattened his nose so badly, but he wouldn't quit. And he eventually became a fire captain. But
Well, the man was resilient and determined.
and
but,
determined, and he
yeah,
was obstructed, and we finally got his nose straightened out, and he lived out the rest of his life
Awesome.
happily ever after.
We know people hire our company to provide, or people, medical practices, and obviously you're a client of ours, but to provide comprehensive allergy testing and immunotherapy. And one of the things that I see all the time from patients as they become a new normal, they let allergies actually keep them from living a wonderful and normal life. So why do you feel that is?
And I think it's exactly that. People get busy. They don't want to be complaining, or they don't think that their particular problem warrants treatment over, say, their kids or some other things, or things that they have to deal with, and they just kind of pressures of life. They ignore it, and they get used to it, and then they can't breathe, and then it starts to cause problems with nasal obstruction, which makes them breathe with their mouth open at night. And they develop other, chronic sinusitis and infections and lung problems and other things that come with it. And people don't think that there's a solution to it, and so oftentimes they ignore it, or they're going to take care of other things for their family that they need to, and they ignore it, or they're afraid of it and they ignore it.
And then people don't realize how good they could feel.
Right.
If they would just address some of these issues and don't let them linger, and
Exactly.
it turns into something actually worse. So you've been in practice for 25 years. What keeps you excited about, what's in the future of ear, nose, and throat practice that you're excited about?
I think there's a lot of neat things that are on the cusp of development coming out. I actually went to a conference and was talking to a young man out of Florida who is helping to direct research using AI. And one of the neat projects that, just for example, is coming out of that is that they're looking at the human genome and tagging certain immune deficiencies and chronic diseases that affect the sinuses, among other things, and helping to use these developmental tools like AI and some of the flow modeling that you didn't have 30, 40 years ago to help advance medicine. So I think you're going to see some dramatic improvements in both medications, because you have things that are biologics, for example, allow you to rapidly develop drugs for, say, nasal polyps. There's a couple of new drugs out for nasal polyps, so that you don't have to have the dramatic surgeries that you used to have. And surgery has become much less invasive, both from endoscopic procedures and robots. And so I think you'll see a kind of revolution in treating things that you may have taken 50 years to develop previously. Now you can develop in 10.
Oh, wow. That's awesome. We'll look forward to that. I know you've had a passion for healthcare real estate. How's that played a role in just running and managing a medical practice? I have a lot of clients that don't own real estate, their own real estate from a business perspective.
Right.
At least, and what advantage you feel has that offered you over the years?
It allowed us some flexibility in terms of the practice to have a reservoir of equity that you can draw on, and if you need to, if you want to expand. It allows the folks in the practice to have the ability to dictate. Say, for instance, we want to change the formatting of the building. Well, you don't really have to go to somebody else and get it approved, because it's not your building. it allows you to change things as needed. And the equity in that's allowed us to go out and build on our new locations so that we have control long term what our overhead's going to be. And that's, I think, the biggest thing is that you can have some predictability, because rent rates go up and they generally don't come down, and they'll continue to escalate over the years.
Right.
And if you can lock it in at an early time in your career, it's worth the trouble.
Gotcha. Given your 25 years in medicine, what do you feel medicine needs more of?
If I had to look forward, I have a son in medical school, and so I'm really proud of him. He just got an international presentation, and he's going to the academy meeting in the fall with a presentation on the treatment of sleep apnea. And I am hoping that introduction of technology will allow us to maintain some sense of control by keeping the ability to produce a medical record without huge numbers of ancillary staff, because it's important for us to have independent thinkers who can work for the patients and be patient advocates. And not that patient advocates don't exist in the hospital systems, but the pressure is very heavy on physicians to practice in an algorithmic fashion that sometimes doesn't always serve the patients. And you need a little bit of that freedom to advocate for the people that you're working for. An example of that is that you have to have a diagnosis to get a scan. And sometimes you don't really know what the answer is. You just know where the area is, and you know it doesn't make sense, and you need to go looking for it. And you need to have the ability to have stuff that's, okay, I don't know what's wrong, I know where I need to look, and I sometimes need to get things that don't really, I can't always give a rationale that fits inside the box that the insurance company is giving me. It will, as more data comes out, be maybe amenable to that, but you need to have allowances for stuff that you don't know, and that the medicine doesn't know.
Right. Well, that's why it's practice of medicine.
As a practice of medicine, exactly.
Right. What do you feel on the flip side? What do you feel medicine needs less of?
I understand the need for cost containment. I understand the need to keep it from having all the society's resources tied up in taking care of healthcare. I think if we can automate some of the administrative tasks, and perhaps eliminate some of that overhead, I think that will be useful.
Right.
I think if you could get people to have a little more vested interest in managing their own, and there've been a lot of suggestions, one of which would be to give them their budget with an incentive that they get to keep some of that money if they are good about losing weights,
right.
Whatever, doing stuff that's healthy, that is moves things in the right direction. That would be good for society as a whole, but still allowing for catastrophic things going wrong. I mean, there's some things that are just, we don't know what's going on, or you have an accident which is out of your control.
Right. So you mentioned your son's medical school. What advice did you give him, or what advice would you give somebody else that's entertaining being a physician?
You have to really love this. You can't predict what the economics are going to be. And one of the other things is that you always have to understand that you can never control outcomes 100%. You can study, but you don't always make an A on the test. And you always need to just simply try and constantly improve things and give yourself the grace as you go through this process to understand that as you're going through the process of medicine, you get better as you go. You know, if you always try and improve your entire career, it makes for a very gratifying career. You can always improve on this job, and for that reason, it's worth doing. We know it's going to be different. We just don't know how it's going to be different.
Right.
But if you're always adding value to what people do, it makes the job worthwhile.
Right. So if you're a patient living in this area, why would they come here?
We want to take good care of you. We want to make it a comfortable experience. And we want to make certain that you get the highest quality care. And we work hard at that. I mean, I'll give my patients my cell phone number, so that if something's going wrong, if I've operated on you, I'm going to give you my cell phone number. You can call me. You know, the job is to get it so that you're doing well. Right. I don't always make it right. Yeah. But we make a solid effort at it, and we honestly try and make that happen. Pretty much across the board, the providers are like that here.
And where can they visit? You have multiple locations, so we're here in Lawrenceville today, but where else do you have practice?
So we have 2 locations in Lawrenceville. One of them is at Riverside Parkway. The other one's at Phillips Boulevard. We have also a sleep study center that's here on Riverside Parkway in a separate facility. We have a office at 1715 Resurgence Drive in Watkinsville, and we have an office in Brazelton. So
all great areas.
All great areas.
Growing. A lot of population growth there. Some amazing people. So I read a stat, especially after the pandemic, so many physicians' doors shut. And now it's roughly around less than 20% of physicians are actually independent. Most are now working for a hospital system or some other entity. So what are maybe some tips that you would give somebody's looking to get into medicine and actually starting their being an independent physician? You know, what are some guidance that you could provide a physician that wants to go that route versus work at a hospital system?
There's a certain amount of job satisfaction that comes with the autonomy of being able to choose your own destiny that is very difficult to quantify. I do believe that the hospital-employed physicians initially have an advantage in the amount of money that they can make. What they don't have is the ability to make money on ancillary services as well as the private physician, but there's a lag time before you can be in on that, just because it takes a while to build the volume. I think as much as possible you want to take advantage of services like yours, because there's a system that goes into certain things like allergies, which you need to have a certain amount of training in the staffing around it and in the system to get paid and in the systems to get the materials and all of that takes a lot of time that is hard to necessarily manage unless you get some exceptional people, which are hard to do in a small practice. Those things make efficiencies that are helpful for private practices. Additionally, I think that you need to always stop and go back and look at which ancillary services are actually making money for you, because that changes. And
One day yes and one day no.
one day yes, one day no, and you'll see that in the ambulatory surgery centers don't really make a lot of money in terms of what they bring in ancillary wise, but the efficiency with which you can get your procedures done is probably worth it at a certain volume, and you just kind of always have to stop and think about it. So it's useful to get a bit of a background in the business of it yourself.
Right.
Always pay attention to that, because it's if you don't pay attention to it, someone else will, and you will be working for them. And the money's got to come from someplace, and it usually comes out of your productivity.
Right. Well, Dr. Dillard, it's been a pleasure. That was a lot of fun.
Always a pleasure.
Yeah, absolutely. Thank you for your time. You've got a wonderful practice. This has been a joy to work with you guys over the years. It's been amazing to see your growth and where you continue to take the practice. And well, obviously, you can tell why you've been successful just being you.
Well, I appreciate that, and you guys have done amazing help for us.
Great. Well, we're glad to do it.
Thank you
sir.
very much. Bye-bye.